Hello, everyone. Welcome back for another episode of Therapy Talks. Today, Harroop Sandhu joins us to talk about EMDR and the flash technique. We deep dive into what is the flash technique and how she uses it with her clients. Hope you enjoy this episode. Welcome, Harroop. I'd love for you to take a moment to introduce yourself and your practice.
Yeah, absolutely. Thanks for having me. So my name is Harroop Sandhu. I'm a registered clinical counselor with over 10 years of experience providing counseling support to individuals from varying backgrounds. My approach is I really want to celebrate the diversity of each client, so really focusing on their unique strengths and perspectives. And so with my work with clients, I tend to integrate several therapeutic approaches. My approach tends to be more holistic and flexible and determined by the needs of each client. So my aim is often to provide a safe, compassionate, accepting atmosphere while empowering individuals to reach their goals. I work for more of a client-centered approach, utilizing an EMDR therapy perspective. And so I'm currently in a few clinics providing counseling services, including peak resilience and counseling, where I utilize EMDR quite a bit in terms of the work that I do with clients.
Yeah, that's so wonderful. It sounds like you offer a lot of diverse modalities, but it sounds like there's a little bit of a focus with EMDR and techniques and interweaves that are related to EMDR.
Yes, yeah, absolutely. I've noticed that I've had a big impact in terms of the success that I've seen with clients when I utilize EMDR, and just them really getting to their goals. So I think that's one of the reasons I'm so passionate about EMDR and even flash technique. I've just seen how successful it can be with clients.
And so I thought it would be really wonderful if we could talk more in depth around the flash technique. So maybe the first question is an obvious one. What is the flash technique?
Yeah, absolutely. That's a really great question because I think lots of people are often like, what is Flash? How do you use that? How do you bring that in as part of sessions? Often, one of the things that comes up around processing when we're talking about traumatic experiences is that there can be lots of things that often block processing of traumatic experiences. It's often that survival instinct that just kicks in, that we want to keep away those like bad experiences that we've had. So one of the things is that with Flash that we can actually do is we can reduce the distress that is connected to these experiences and make it easier for clients to engage in processing the traumatic experiences. So the Flash technique originally evolved as Philip Manfield sought a strategy to use during the preparation phase of EMDR to basically help reduce the overwhelming, disturbing memory so that clients could actually tolerate those memories without shutting down or becoming overwhelmed or disassociating. And so really with flash technique, what we're doing is we're not actually getting clients to focus on the event itself. We're having them engage around a positive, engaging focus, and that be the focus of just the technique that we're using. And that'll actually help reduce the distress or disturbance that's connected to the memory or experience.
Okay, so just to kind of summarize that a little bit, part of what we do as EMDR clinicians is we prepare clients to have certain memories be reprocessed and desensitized.
Yes.
But often clients have an overwhelm or intense emotional experience with when thinking or thinking back upon that memory.
Yeah.
So it sounds like the flash technique is an opportunity to almost titrate or reduce the distress before reprocessing or desensitizing.
Yeah, absolutely. And I mean, really all they're doing is that they're thinking of something positive or exciting that they can talk about. We usually focus on that for about 10 to 15 minutes. And so it can be like about a hobby, a pet, a movie, a trip. Some people can even talk about music or play music. So there's lots of different things that we can focus on as part of that positive, engaging focus. So that's what they get to talk about. They're not having to think about the event or even talk about it at all.
Okay. So how would that look like in a session? Like what would you do to facilitate the flash technique?
Yeah, so really with Flash, the process starts with the client identifying a memory or fear. And then what we do is we rank the level of disturbance that they're feeling in that moment. So similar with the EMDR, we use the subjective units of distress scale, which ranges from 0 to 10, with 10 being the most disturbing. And then what I would do is I would ask the client to think of something positive or exciting that they can talk about for the next 10 to 15 minutes or so. And we collaboratively decide what that is that they want to talk about. And so once they've identified that, what we will do is we'll start to talk about that. They'll do some tapping. And then when I say flash, they do a series of successive eye blinking. And then after that, what we do is then, just check back in. Where is the distress or the disturbance around that initial memory?
So, what does the eye blinking facilitate?
Yeah, so essentially what it is that we're, subconsciously allowing that client to focus on a positive memory, which is now reducing the distress or disturbance without consciously having to access any of that material. So we're almost kind of pairing that positive, engaging focus with that traumatic experience, which is now bringing down the distress related to the traumatic event.
So, just to make sure I'm understanding it correctly, because the flash technique isn't something that I've trained in at this time, but definitely something I was interested in learning more about. So, a client would think about the distressing memory, but then immediately think of something enjoyable or comfortable or positive.
Yes.
Okay. So, it's like shifting the focus.
Absolutely. Yeah. And so the more they're accessing that positive state is now being paired with that original experience. So that's essentially what's helping them, reduce the distress that is now connected to that previous experience.
Hmm. Do you find that the flash technique then would allow a shorter preparation period in some cases of EMDR?
Yeah, absolutely. Especially with clients who have more complex trauma where there's been several different events that have happened or, there's been those repeated experiences that have happened. It can be really hard to go back to and access those original experiences just because they bring up such intense emotions, feelings, or sensations. And so for some clients, it's even hard to tolerate just talking about that or even going back to that experience. So essentially with Flash, what we can do is we just are lightly touching on it and then we're not really talking about that any further. And just through doing the Flash technique, we're reducing the distress or disturbance. And for some clients, that can actually go down to zero with doing just the Flash technique. So what's really great about Flash is that it can be used on its own, or it can also be used in conjunction with EMDR as preparing to go in and do the full EMDR sequence around processing through an event.
Interesting. What would be the criticism of the flash technique?
I mean, in terms of criticism, I don't know that I can actually find one because I found it has actually been really beneficial with clients. And so I think the only thing sometimes is challenging for clients to find what is that positive engaging focus. How do I really kind of connect to that? What feels meaningful? So that can sometimes be hard for clients to find that focus. Or the other thing is where there's been more of that complex trauma, sometimes it takes more time just because we're having to process through several different things. So if we haven't actually always touched on what the earliest memory is, sometimes we do have to go back and find what that is. That is one of those things with Flash, is that we're usually trying to go back to what was the earliest experience.
Okay. Just because when I was thinking of this in the way that you're describing it, one criticism that could be true or not, I'm just thinking of as we discuss this is if it reduces maybe some of the preparation time for EMDR, like the way that I would practice is I try and give clients a lot of tools for
Yes.
regulation. So by able to skip past or speed through perhaps some of the preparation, maybe they're not leaving counseling with as many tools.
Yeah, which I mean, I think with Flash, I mean, we still are incorporating that with all the other resources that we'd be bringing in for clients. And so, I mean, I think I still use resourcing with clients because we want them to have some of those tools to kind of walk away with. And so it's often a very collaborative process. We're just talking about, what are some of the things that we're wanting to target? How do we give them some resources to just deal with daily stressors as well and just finding ways to manage any of the symptoms that there are going on. And then continuing to bring the Flash technique as we're trying to reduce the distress that's maybe connected to some of those previous traumatic experiences that have happened.
Okay. Just curious because I'm just listening and trying to conceptualize like how that would be put into practice.
Yeah.
What would be some considerations for the flash techniques with maybe individuals with more complex trauma?
Yeah, absolutely. And so with individuals with more complex trauma, I mean, I think it's often one of the things that's really important is getting a thorough history and getting the understanding of what have been the events and experiences that they've gone through. Because often with complex trauma, it's not just one, there have been several experiences that they've had. So really going through still as you would with the EMDR, that thorough intake and history taking, because you really want to try to understand what have been the events and experiences that have really impacted this individual. And then how do we decide what it is that we're working on and what it is that we're trying to target? So I think that's still a really important part of that. And the nice thing to think about Flash is that if dissociation is present, it's still easy to use that to reduce the distress because we're not engaging with the original event or traumatic memory. A lot of those defense mechanisms are not going to block the processing in the same way.
Hmm. So it would be more ideal for someone that isn't dissociating most of the time, though, because if they're already constantly or more present in dissociation, then
Yes.
they maybe wouldn't be able to engage in the flash technique as effectively.
Yeah, I mean, yeah, especially if they're having a harder time connecting to those positive feelings, they're disassociating, there isn't that ability to kind of track what's going on in their body or even just notice some of that. That might be a little bit harder. So again, I think that's where we can bring in tools from that EMDR preparation phases, which we're just really trying to give them some of those resources so that we can access them and help them track and notice what it is that's going on in terms of just noticing that distress or disturbance.
Interesting. Okay. And so if you were meeting a client for the first time, like what would be your way that you explain the flash technique at that? Like if you were to introduce it, like do you have a certain example or metaphor that you would use?
I mean, I generally just kind of say it's, essentially what we're doing is that we are just trying to identify what are the experiences that you have had happen and what is it that you want to process through. And then we're just going to be focusing on something that's totally not connected to that feels positive and feels like it's something that you can really engage around. And that essentially your brain knows exactly what it needs to do to kind of do some of that work. And that with that, we're able to actually reduce that distress tolerance and tolerate more of that experience. And so essentially, we're helping that disturbance go down without even ever having to focus on that, which I think for most clients, they find that really cool. They're like, wow, I don't even have to kind of talk about it or think about it. That feels a lot more manageable. That feels a lot easier for me to conceptualize.
So would the flash technique be more effective at the desensitization piece rather than the reprocessing piece? What I mean by that is it kind of just brings down the distress, but maybe there isn't a more adaptive lens that is now given or seen through for that experience.
Yeah. So, I mean, one of the things with Flash that's really interesting is that it can completely be used on its own. So, I mean, essentially, you can actually have a target go down to zero just by using the Flash technique. And so it actually can be used for both, which is, I think, what's really cool about Flash, is that it can just be used as a standalone process and that you don't even need to go into EMDR processing, or though it can be used as a way of bringing down that distress or disturbance to help a client get to the reprocessing stage with the EMDR targets. So, I mean, really, it's one of those things that can be used in both scenarios. And it really just depends on the client and the experiences and, how long that process takes around starting to reduce that distress or disturbance.
Because I was just I was looking over Francine Shapiro's Getting Past Your Past book recently, and I was just rereading the part around how she had the discovery for EMDR. And she said that one of her first noticings was that when she moved her eyes back and forth as she would recount something that was upsetting for her, that distress would reduce.
Yes.
Right. And so that's why I was trying to see if like the flash technique did that. But then the EMDR also seemed to provide new insights or things or perspectives.
Yes. Yeah. Which I mean, again, some of the things that people do experiencing through the Flash technique is that they now notice that they actually have a positive belief that is now connected to the original event or experience. So I think that's what makes Flash technique so cool is that it sometimes you don't even need to go through the full EMDR processing. I've used this with clients and we have gotten to SUD 0 and, we continue to go back and reassess. And that what we notice is that it is still at that SUD 0, that they're still noticing those positive changes. They're still noticing that they've connected to that new positive belief and that there is none of that distress or disturbance when they think back to the original event. So yeah, I think it's really cool is that, it seems that it really works for clients and that they notice those longstanding changes.
For sure. And so how long has the flash technique been around?
Yeah. So, I mean, I think the Flash technique has been around for some time here. I don't know exactly when that first was developed, but I mean, my sense is it's definitely been around for a while and they've been doing a lot more research on the Flash technique. So it's something that's continuously evolving and changing as well. And so originally with Flash, what they would be doing is that you would have to kind of, be exposed to the original event for shorter and shorter times. And what they learned through research is that you don't even need to do that at all now. And so essentially you're just focusing on the positive, engaging focus. And you don't even need to go back to the original event at all. And that they've noticed that has a lot of success just even doing it that way.
And like you mentioned earlier, when they check back in with those clients, they're still having that resolution or lack of distress many years in the future.
Yes.
Okay, cool. Just because like when we talk about EMDR sometimes is that there's this idea that if we don't process everything, that is not the best, but it's okay because you can always return to it and continue processing if there's any metaphorical roots left untouched.
Absolutely. Yeah. Which I think with Flash, what's, great is we are always going back to reevaluate and seeing like, are we noticing if there is any distress or disturbance that is still coming up around that, and just continuing to process through that. And then if we feel that it's helpful or advantage to bring in EMDR, we can still do that. And so, I mean, those two work really nicely together, which is what I really love about Flash, is that you can use it alone or you can use it in conjunction with EMDR, and that they work really nicely, because then clients are almost feeling primed for EMDR. They're feeling more ready and able to take on the processing phase of EMDR.
Mhm. So when you see clients and maybe they don't have complex trauma or there isn't those single incident traumas and a client comes to you, say, for a life transition, how would you case conceptualize using four blanks or EMDR for someone maybe coming to you with a life transition?
Yeah. And so, I mean, one of the things with like EMDR is that you don't have to always have like, something that's happened previously that you have to do in terms of processing. It's almost like you can help clients start to kind of imagine what is the event that's coming up that brings up some stress, and how do we help them just start to do some, imaging or visualization around effectively, being able to manage that experience. And so, yeah, I mean, often with EMDR, that's that phase of where we're looking at, building that bridge around, what are the resources or the skills or the tools that they can use moving forward in terms of like the future template. And so, yeah, you can even apply that to things like that. So, I mean, I think one of the things with EMDR that's really great is there's lots of different pieces to it that you can apply, even if you don't do the full EMDR procedure.
Right, because you can resource or you can install positive beliefs or you can prepare for the future.
Absolutely.
Hmm. And so, what are some of the main types of clients that you see in your practice?
Yeah, so I see a variety of different clients. A lot of the clients that I do see is a lot of BIPOC clients who come from different experiences. And one of the themes that often we touch upon is intergenerational trauma, which seems to be a big piece. And so often, many people's experiences is not just the trauma that they've experienced, but maybe the trauma that they've seen their family go through. And so, with EMDR, one of the great things is that we can start to process through, well, what was that client's experience of witnessing people around them that they loved, being traumatized or being in those survival states, and how that impacted them. So I think that's one of the things that EMDR has really evolved into, is it isn't just what's considered those like big T traumas. It can also be those little T traumas where it's more chronic in nature, and what that's meant in terms of somebody's like, ongoing experience.
Definitely. And so, could you quickly just also define a little bit of what is intergenerational trauma for those listening that may not know?
Yeah, absolutely. So intergenerational trauma is often, when previous generations and families have experienced trauma, and as a result of that trauma and the survival mechanisms that have now been in place, that can impact the next generation. Because when you see or witness a parent who's in survival, and that they've had to learn their own survival coping strategies, that can really impact, the next generation, because they also see that, and are living at the effect of that. And so that can be multiple generations. I mean, if you've had parents who've been through war, that they've been through political instability or things like that, that's going to have a huge impact in terms of their lived experiences, and that sense of overall safety. And so if there hasn't been that sense of safety and stability, that's going to have a huge impact in terms of how people are even, parenting, or how they're even, just going about day-to-day life, which, children are going to be noticing all that. They're going to see all of that modeling.
And so, a question I actually had from a client that they asked me, and I'm curious on your answer as well, is they said, well, is it intergenerational trauma if I maybe didn't see my grandparents or I wasn't really around my parents that often? Could I still be impacted by that intergenerational trauma?
Yeah, absolutely. And I mean, I think one of the things that research is pointing to more and more is that, the nervous system for children actually starts to wire up very early in life. I mean, within 6 months in utero, the nervous system is already starting to develop. And so all of, a parent's stress responses in terms of just trying to manage and navigate day to day, all of that is going to be filtered down neurohormonally into the child's experiences as well. And so when you talk about things like that, I mean, there can be lots of significant implications for what that means, in terms of people's experiences of having families or parents who've been through trauma.
hmm And that's why it was a really interesting answer too, as well, because we often think that we just have to see the trauma to have it be impacting. But again, it goes back to that point. It's more of like the trauma is what happens inside of us as a result of things, right?
Absolutely.
Mm-hmm.
Yeah, which and that's just it, right? I mean, I think it's often, in terms of the trauma is the impact is what was the emotional impact that it had on you, not necessarily just the experience itself, but what was the emotional impact of that event and that experience. And so if you had a parent who lived through traumatic experiences, what would that emotional impact have been, and how would that have changed how they navigated day-to-day life, how they navigated family dynamics, how they learned how to just cope and deal with environmental stressors, which again, through a lot of modeling, children are going to be picking all of that up. They're going to be exposed to all of that.
Mm-hmm, definitely. So even, for example, someone who maybe wasn't raised by their birth parents could still have been affected by their birth parents' well-being, despite even being raised by their adoptive parents or other family members.
Yeah, absolutely. Which, and again, I mean, I think this is just, one of those areas of research that they're getting more into is in terms of epigenetics and just understanding how, the brain and nervous system starts to wire up and how early on in life that seems to happen. And so, yeah, I mean, it's definitely one of those things that seems we're having more of an understanding of, that it seems to start quite early in life. Like it can start to have a significant impact pretty early on.
Mm-hmm. And with the clients that identify as BIPOC, what are some of the main themes that you see there in your sessions?
Yeah, there are lots of different themes that tend to come up. One of the things that I often notice is that there is often a lot of guilt that is associated with having privilege that their parents didn't. Not having to deal with struggles that their parents didn't, because there's often been just so much self-sacrifice that's happened that they've seen growing up, and so for them, it leaves them with a lot of guilt around having resources that their parents maybe didn't have, having the privilege to make choices that their parents maybe didn't have, and having opportunities that their parents didn't have or their families didn't have. And so that can create a lot of struggle. And there can also be lots of shame that then comes up around that. Is in the sense, it feels like I somehow had it easier than my family did. And there's that sense of like shame of feeling like, well, I don't know that I should have this easier than they had it.
Mm-hmm. And so if you were to apply maybe the flash technique or EMDR, how would you conceptualize that sort of case or theme?
Yeah, and so I think that's where it's really important to really kind of dig into doing, a thorough history taking at the very beginning, understanding, what were family dynamics like, understanding not just the client's trauma, but what was the trauma that, happened for your parents or caregivers or your family members. What were some of the stressors that were going on? What were people dealing with? So that you get a sense of, what was an environment like, because that was going to have a huge impact, for a client in terms of the type of environment that they grew up in. So how do we really start to understand that? How do we understand more of that like attachment or connection relationship, and how that would have impacted a client's experiences, and that sense of emotional attunement as well, and how available they felt, their family or their caregivers were.
Mm-hmm. And so again, like going into their history, understanding the situations or impacts, moments that really impacted them, and then how that shows up.
Absolutely. Yeah, which I think is also, sometimes psychoeducation with clients is helping them to understand that, helping them to connect how significant, attachment relationships are, and how that is a significant part of, nervous system regulation and emotional regulation, that often has a really, really big impact. So helping them to kind of understand what were some of those experiences, what were possibly some of those impacts, and then how do we start to move through and start to process through some of those experiences in terms of the impact that it had on clients.
Mm-hmm, definitely. And so again, the psychoeducation, the history taking, all that would inform of like the process that you would go through with a client.
Absolutely, yes.
Mhm. Who are some of your favorite theorists or psychologists or lenses that you really pull from personally and professionally into your practice?
Yeah, there's a lot of different theorists that really speak to me. There's definitely, attachment is one of those big focuses for me. And so, I mean, there's lots of great attachment theorists out there, anywhere from like Bowlby to Dr. Neufeld or other, psychologists who are in the field and just doing some really great groundbreaking research on this. And so they've done some really, really great research. There's lots of information that's coming out around, how significant early attachment and what's going on within a family system and how much of an impact that can have on individuals. So yeah, that's definitely some of those things, along with just, the standards of like, Carl Rogers and just, again, that person-centered approach and really honoring the client, and really just, honoring that therapeutic relationship and that rapport and how significant and important that is as a part of even the EMDR or flash process, that it's got to start with that sense of safety within that relationship, so that we can even start to kind of like, explore or touch on some of these things that have had a significant impact on people.
Mhm. And how long were you in practice before you learned EMDR?
Yeah, so I was in practice for about 3 years prior to doing EMDR. And I think I was just at a point where I was noticing that with, some of the other therapies or, modalities that I was bringing in, it was almost like we would hit a wall at some point. Like we would start to resource clients, but they were still noticing that they had ongoing symptoms that were going on, and that while they had resources, it didn't feel like it really got to the root of what the issue was, or they didn't feel like it fully resolved for them. And so I had a desire to kind of find some other modalities that really would help me support clients in doing some of that work that they were really wanting to do. And so I had heard about EMDR and heard that it is quite, effective. And once I took the training, I think I just fell in love with the approach because it felt like it went past just the talking or just the resourcing and felt like we were getting down to deeper levels of clients really processing through experiences and coming to insights and awarenesses on their own. I think that's where I really started to notice a shift for clients is it wasn't just what was happening through our kind of conversations and our, approach in terms of trying to help them understand their experiences. They were starting to connect to all of that on their own. And they were starting to have these new positive beliefs and new positive insights in terms of the resources and the resilience and the strength that they had.
And you kind of lead it into my next question. Did you find it was hard to look at clients outside of an EMDR lens or a trauma-informed lens once you started that training and worked with clients in that modality?
Absolutely. I think once you've started down that road, it's really hard to not case conceptualize from that theoretical standpoint. And so, I mean, I find it's one of those things that, with clients that I'm often kind of looking at and reflecting on. So, I mean, even for clients who are coming in with things like anxiety, depression, or things like that, that would feel fairly standard, it's again often exploring, okay, if this is something that you are wanting to explore more deeply, how do we get to the roots of maybe where some of this started from? And what were the life experiences that impacted you? And how do we start to really process through that, so that you notice those significant shifts and changes that you're wanting and seeing in terms of your daily functioning?
Definitely. Because I found like, again, like you, my experience was, okay, we're learning skills, we're learning more awareness, we're learning how to do a lot of cognitive things, but it's still there. It felt like it was still so reactionary, and that initial challenge or trigger or emotional disturbance was still always there. And it felt like a lot of other therapies really followed it versus EMDR was allowing you to really not have that be a disturbance or a trigger from the get-go.
Yes. Yeah, absolutely. And I think, the thing is I think clients also start to really understand, how significant and impactful some experiences have had. Often I think what happens is a lot of early memories can be repressed and there's not necessarily that conscious connection to those experiences. And I think the more we start to do some of that exploration, they start to connect to how significant some life events have been, and how much of an impact that they have had. And so I think it's almost like clients are starting to get to know themselves at such a deeper level and understanding their own kind of personal journey and experiences that they've had.
And something that I noticed that has been really soothing and empowering to see is clients take off some of the blame, on themselves because they see how all of these experiences really impact them, you
Yeah,
know?
and that's one of the things I think I've really noticed with trauma is how much shame starts to get internalized. Is was it my fault that this happened to me, or how did I, what does it say about me that this has happened to me? And so I think through EMDR and Flash is what you're really helping clients do is shed some of that shame and recognize that they're actually can have positive beliefs about themselves through that experience as opposed to taking on that negative belief about themselves through that traumatic experience that they've had. And so I think that's really incredible to get to witness clients getting to let go of some of that, and feeling lighter from that, feeling more distant from those experiences, and not having to feel that level of shame that they carry around that's been connected to those events that have happened for them.
So, what do you feel like we've missed so far in terms of the understanding of the flash technique in your practice?
One of the things that I've noticed with clients is where there is that hesitancy or resistance to, I know I've had some hard experiences, but I've essentially tucked that away in a box and I don't necessarily want to open up that box. I don't necessarily want to go back into that because, essentially it's helped me kind of cope and move through life at this point. So that feels really scary, or that feels really daunting. That feels really overwhelming, the idea that I'd have to go back and unpack some of those things. And so I think what's really nice with Flash is that we can really start to reduce that distress or disturbance that's connected to that. So it almost makes it feel like it's maybe more manageable, or it's easier to start to unlock that box and start to go back to what some of those events or experiences were for clients. And so, yeah, I think it almost gives them some of that confidence of, yeah, I can manage this, and it feels like there's not as much distress. And so it feels like I can maybe face that and look at what were some of these experiences that I've had. And again, I think, with clients, I think the thing for them that they often notice is how profound the shift is. It's like, I'm aware that experience has happened to me. It's like, I know it's part of my memories, but I just don't feel the same emotional charge around that experience anymore. I don't notice the same flooding of feelings or thoughts or sensations. And so it's almost like it's created this distance. It's there, but it's like, I just don't feel emotionally connected to it in the same way anymore.
And I like that point around individuals are really good at tucking things away, but they don't seem to recognize how even if we've tucked away a disturbance or a challenge or a hurtful experience from the past, it can still really impact the way that we respond to things. And so I think you're trying to instill that bit of bravery to maybe go back to some of those memories and really truly let them go or see them differently or truly have them be at zero disturbance, because it can really impact the decisions that we make, the way that we see ourselves, the way that we respond to different in relationships or situations.
Absolutely. Yeah, it can have an impact in a whole bunch of different ways in our life. And I think, not even knowing how much that's contributing to how we're just functioning in our day-to-day lives, it can impact our relationships and how we communicate, how we navigate conflict, how we express our needs, and our feeling that we get to even express our needs or have those be met. It can really show up in terms of how do we handle stresses, or how do we tolerate emotional distress or things like that come up. And so it can have so many different impacts. And again, I think the more that we can kind of get to the root of what's going on, people start to notice those shifts in all areas of their life, which I think feels encouraging for them. Is it feels like I've got the resources to do things differently. I feel like I've got the resources to make those changes that I really am wanting to make, which really is creating that long lasting difference that they're really looking for.
Definitely, because it really is that shift that you can have from some of these sorts of experiences. And it's kind of interesting because sometimes there's a bit of a defense mechanism where someone goes, oh, well, I don't think about that. Like that's really past. But when they actually spend a moment truly thinking and experiencing, notice any somatic symptoms, there might still be that disturbance there, which could warrant that opportunity to go back and do that reprocessing.
Absolutely. Yeah. Or even realizing how much people have not been connected to their own felt sense of things, and how much they've either been living in their head, or that they're noticing they're not even feeling connected to their life, and that there's a sense of just feeling disconnected from so much of what's going on around them. And so I think, again, it gives them just a whole different experience of how they get to be in their own body and how they get to experience their life and their world. And so, yeah, I think the more we give them those resources and we get to start to move through and process some of those things, they get to experience their life in a whole different way, which is really, really awesome to get to witness clients go through that journey. And what I love about EMDR and Flash is that essentially this all comes from the client. It's not that I'm the one who's putting any of this there. I'm not the one taking you there. Clients subconscious, and they know exactly where we need to go and what we need to move through. So I think it empowers clients to kind of recognize you're actually the expert here. You're the one who's leading this. And that, you get to be the one who actually also gets to have these insights and awarenesses, and that you're the one who's affecting a lot of this change.
Which I think is you're doing a great job at breaking one of the misconceptions of therapy overall, is that as a therapist, we don't treat you. We use our information, our psychological modality, our training to help support you, but the client still always is that person that is leading it and creating those insights. Because I actually was speaking to someone who had some criticisms or feedback around EMDR, and they said, well, aren't you kind of telling the client what they should think or feel? And I say, well, no, like 1% yes, because ideally I do want them to feel a peace, whatever
Yes.
form that looks like.
Yeah, of course.
But it's like you said, the mind will go where it wants to go. The insight that comes up is going to be from them, and that insight's going to allow them to see that experience differently. And therefore, that's going to give them that peace. And I'm sure you can be often surprised what clients come up with because it's not something that maybe you even thought of, but that allows them to see that experience a lot differently.
Absolutely. And it's so interesting because I think sometimes even clients will have an initial conceptualization of what they think, certain symptoms that they're noticing are connected to. And through the EMDR process, what we'll often uncover is that there's actually experiences that have happened that seem unrelated, but have now been connected through a specific theme in terms of how their brain has now filed away some of those experiences. So I think that's what's really interesting about the journey of EMDR Flash, is that we start to connect with experiences maybe clients didn't even realize were so significant in terms of how that impacted them, and really helping them to kind of deconstruct some of that and understand some of that. So I find that comes up a lot with phobias. I think clients often think, well, if like I have a dog phobia, it was because I had this one really awful experience that I had with a dog. And that's what that's kind of connected to. And sometimes the more we explore that, they can have had other experiences that are actually not connected to dogs at all. And that's where actually some of that phobia came from. So that's what I think is really cool is that like it is their brain that's showing us the way around what were those experiences and what do we still need to process through.
Definitely. I think that's a really good thing to notice as well, because we may not always understand why or how we adapted or maladapted from previous experiences.
Absolutely. Yeah. And I mean, and that's the big thing is that when there's been that maladaptive coping is that we're essentially trying to help the processing complete so that it can come out with an adaptive response, that there is that new belief, there is that new insight, there is that new resource or that strength that the client takes away. So when it comes forward, moving into any future experiences, they have those resources or those strengths to draw on, and that they're noticing it just doesn't bring up that same level of fear for them of being able to manage those future experiences.
Yeah. And going back to something we touched on earlier, what would you say to a client that is interested in EMDR? What would you do to maybe support them in the decision to possibly choose EMDR as a modality?
Yeah. And so, I think there's this like conceptualization that EMDR is like really fast and that it's automatically going to be one of those things that we can kind of get through really, really quickly. And so, I always want to like have clients understand that EMDR processing is really going to depend on what it is that we're processing through and what your experiences have been. And so, EMDR sometimes can take longer than you anticipated. And also that, it's going to bring up a lot of distressing emotions. So where's your capacity to hold that right now? And what do we need to do to get there so that you can hold those experiences? And so I think it's, helping clients to understand that is I do think EMDR processing can be shorter, but that doesn't necessarily mean you've had like 6 sessions and then you're done. That's how that works. I think helping clients to understand that EMDR even in of itself is a very individual process and it's not going to look the same for any one person. So that we really have to determine what were those life experiences that impacted you? What are your goals for counseling? And how do we work to get there? And are you willing to kind of engage in this process? Is this something you want to take on and are ready to take on right now?
And do you see different commitment level from different client populations?
Yeah, absolutely. Which I think there can be so many different factors that weigh into that. I mean, there can be certainly around like finances and resources can certainly be one of those things. And for some clients, it's again that sense of that just that fear of like if I unlock this, how many other things am I going to be unlocking, and am I ready or am I prepared to start to do that? Or as I start to make changes, what else might shift in my life? Is there the sense of that, like, it might start to impact my relationships and in ways that like could potentially feel negative is that there's creates more conflict or more tension because I'm now engaging in different ways in my life. So I think for some clients, there's some of those things that act as blocks or barriers to them wanting to kind of engage in EMDR or move forward that.
Definitely. And I think a misconception that I share with people often is I do end up seeing a lot of clients because of some of the reasons that you listed. Like, I think that's why a lot of clients will start and then maybe they're faced with some challenges or they're fearful to share how they're really feeling, or maybe they're not having the right client therapist fit or the financial aspect, or really understanding that therapy is not just that hour. It is really much that commitment to the well-being.
Yes, absolutely. Which, yeah, I think for some people that can feel daunting as they start the processes is like, what is that going to look like? And how am I going to even be able to take all of that on? Which for some people, they have different things going on in their life that maybe it just feels like, I don't know that this is something that I've got the capacity for right now. I don't know if I'm in a space where I can really, really take this on right now.
And so where do you see yourself and your practice growing to?
Yeah, I really see myself continuing to use EMDR. And one of the things I love about EMDR is just all the advances that are happening with EMDR and, all of the advanced trainings and the different kind of the things that you could weave into EMDR. So I'm really passionate about that. Really delving more into like early trauma processing, also just some of the, different modalities with like blending IFS with EMDR and different things like that. So I think that's what really excites me is how much evolution is happening within the field of EMDR and things like Flash getting to incorporate that. So it feels like there's all these really, really great other tools or trainings that fit quite nicely with the EMDRs, which is what I really, really love, is that I can blend in a lot of the other training or approaches that I would use anyways, and have that really nicely complement EMDR. So I see myself more and more, working primarily with EMDR with clients because I've just seen how much of an impact and effect it has. And it makes me really excited for clients and getting to work with them because I often see that long-standing change that they're really, really wanting or that they're really, really looking for.
And so if a client's listening and they feel like you might be the right fit for them for therapy, where can they find you?
Yeah, so they can find me at Peak Resilience on their website. I'm on there, and then also with Kindred Counseling, or they can email me at Harroop@HarroopSandhuCounseling.com. That's my personal email. And so, yeah, those are some of the ways that they can get in touch with me. And yeah, this is a approach that I'm really, really passionate about and happy to kind of talk about and share with clients. So yeah, I love getting to explore this with clients and just talk about, what their goals are and where they'd like to go, and how it is that we can start to incorporate that as part of like the therapeutic process.
Definitely. Well, I appreciate that so much. And I really appreciate you joining us today and taking the time to explain the flash technique, EMDR, and what type of practices that you engage in.
Yeah, absolutely. Thank you so much for having me. It's been lovely
Yeah.
chatting with you today.
Thanks so much.